Calendar Year 2020 Performance Contract Report Public Input Meeting. Welcome. Each year, the Department of Developmental Services, DDS, and IRC develop a performance contract to determine and measure how IRC delivers services. Translation Services. This meeting is being broadcasted in English and Spanish. All items are located on inlandrc.org and we post it in the chat room. Please follow the links below to find the correct report for calendar year 2020. Disclaimer. Inland Regional Center is taking measures to minimize the spread of COVID-19 in our community. As an agency, we are operating under the directive of the Department of Developmental Services, DDS, and following the guidelines of the Centers for Disease Control and Prevention, CDC. We are also strictly following state and county COVID-19 regulations. Inland Regional Center is not hosting in-person events in order to protect our staff, vendors, clients, and community partners. To the best of our ability, we will hold virtual Client Advisory Committee, CAC meetings, Board of Trustee meetings, Purchase of Service Public Input meetings, Performance Contract Input meetings, 2021 IRC Virtual Fall Festival, and Vendor Advisory Committee, VAC, meetings, so we can remain connected to those we serve until it is deemed safe to resume face-to-face events. Overlapping public policy measures. During this presentation, you may be asked to refer to a previous public policy measure to see the activities that were performed. Many goals overlap and intersect with each other. Hence, activities can relate to the successful completion of another goal. Public policy measure number 1. Indicators showing the relationship between annual authorized services and expenditures by an individual's resident type and ethnicity. IRC analyzed the purchase of service POS data to identify areas where we may be able to increase purchase services to better meet the needs of the underserved population. Purchase service reports, fiscal year 2018-2019. To review POS reports from fiscal year 2018-2019, please use the links below. They will also be posted in the chat room. These links will take you to the final report and discuss disparity in the purchase of service in both English and Spanish. Our next virtual public meeting will be held on April 21st, 2021 in English at 4 p.m. and Spanish at 5 p.m. This meeting is for the Public Input Fiscal Year 2020 Purchase of Service Report. Public Policy Measure Number 2. Percent of total annual purchase of service expenditures by individuals, ethnicity, and age. Birth to age 2 inclusive. Age 3 to 21 inclusive. 22 and older. IRC continued to develop the cultural specialist position to increase education, engagement, and cultural competency of IRC staff, clients, families, and community partners. The cultural specialists also maintained detailed records, collected data, and tracked the qualitative and quantitative outcomes of our community-based organizations. To see more activities performed to accomplish this goal, please see the report as posted in the chat room. Public Policy Measure Number 3. Number and percentage of individuals receiving only case management services by age and ethnicity. Birth to age 2 inclusive. Age 3 to 21 inclusive. 22 and older. IRC continued to participate in interagency collaborations with the Department of Behavioral Health, local police departments, and crisis intervention teams to address the increased interaction with clients not attending a program. IRC continued to support the Clients Advisory Committee, CAC, in providing educational forums and events. These events can help link a client to day programs, behavior programs, or work programs. IRC partnered with the San Bernardino Kiwanis Club to start an IRC Action Club. The Action Club is the only service club for adults with disabilities with more than 12,000 members worldwide. The club provided adults living with a disability an opportunity to develop initiative, leadership skills, and to serve their community. IRC continued to develop and improve inletrc.org to develop information on IRC's eligibility, the intake process, and community training. Public policy measure number 4, total number of $1,000, $1,250, or $1,500 incentive payments made for fiscal year. IRC employment specialists continue to provide outreach and community education on employment opportunities and available supports virtually during the pandemic. The IRC employment specialists were unable to partner with the IRC Client Advisory Committee and local CBOs to host a 4-hour employment conference linking clients to competitive integrated employment or paid internships based on the COVID-19 shelter-in-place order. However, on April 17, 2021, the employment specialists were able to partner with Chasing 7 Dreams Employment Conference and present on several different subjects linking clients to competitive employment. Public policy measure number 5, increase the number and percent of adults residing in the home of a parent or guardian, family homes. Family homes can have many different meanings, but the key idea is a place where a person chooses to live. IRC continued to assist families in obtaining needed services. Such services included in-home services, respite, behavioral intervention, parent training, hospice, and crisis intervention. Public policy measure number 5 continued. Inland Regional Center enhanced inletrc.org and now maintain a common service list to help clients, a service provider search tool to assist clients, fact sheets for common services, day programs, living options, respite, and transition, a calendar of community activities so that the clients, parents, or guardians can search for low-cost community events. As well, IRC built and maintained a COVID-19 resource page. Public policy measure number 6, decrease the number and percentage of regional center caseload in state developmental centers. IRC continued to support families and clients as they move out of developmental centers and into the community, with community placement plan funds as available. Public policy measure number 7, increased number and percent of minors residing with families or home settings. Home settings can include the home of a parent or a guardian, as well as a foster home agency home. IRC continued developing and providing group parent training and support for families within the specific ethnic groups served by IRC. IRC provided virtual training for families to help manage behaviors that may interfere with a child's ability to interact with their family and community. IRC continued assessing, developing, and providing families with services to keep children in their own home. IRC continued the preference of small 4 to 6 bed homes for out-of-home placement. Public policy measure number 8, increase the number and percentage of adults residing in home settings. Home-like settings can include independent living, supportive living settings, adult family agency homes, and a client's family home. IRC continued to develop and provide services and support to clients, allowing them to be as independent as possible. IRC continued to monitor the implementation of AB 1472 to ensure that clients are respected and compliance is achieved. Public policy measure number 9, decrease the number of minors living in facilities serving 6 or more people. IRC believes that children develop best in loving, inclusive homes. However, in some compelling circumstances, they may require alternative placement. Southern California has the only subacute facility for children. Many children throughout California are transferred from their home regional centers to the subacute facility, which serves more than 6. IRC will work in partnership with the transferring regional centers and provide shared case management. To the greatest extent possible, services were identified and provided that allows for the child to successfully transition back to their home. Public policy measure number 10. Decrease number and percentage of adults living in facilities serving more than 6 people. Inland Regional Center's Board of Trustees confirmed its policy to support living arrangements that are small, serve 4 to 6 people. Adults are provided with private bedrooms and bathrooms. IRC evaluated the cases of clients who live in large skilled nursing facilities. Their needs were assessed to see if they can be appropriately served in a smaller setting. Public policy measure number 11. IRC's core values are independence, inclusion, and empowerment. We believe that clients with an earned income exemplify these values. Number and percentage of clients aged 16 to 64 with an earned income. IRC employment specialists provided community outreach and education on employment opportunities and available supports to community partners, vendors, and clients. This was conducted virtually as much as possible over the period of the COVID-19 shelter-in-place order and numerous surges. As well, to enhance the client and vendor and possible community partners' ability to understand client employment, a new page was created. Please feel free to visit inlandrc.org/consumer-employment page for more details. Public policy measure number 12. Annual earnings of clients aged 16 to 64 compared to people with all disabilities. IRC believes in equal pay for employees who perform similar work. To view the complete Spring 2020 employment report, please follow the link below, which we will post in the chat room. Public policy measure number 13. Average annual wages for clients aged 16 to 64. See measure number 12. Public policy measure number 14. Number of adults who attain competitive integrative employment following participation in a paid internship program. IRC participated in job and employment fairs to promote employment opportunities for those who participated in a paid internship program. This was completed virtually as much as possible. IRC's employment specialists stressed the importance of paid internship programs at the Vendor Advisory Committee and subcommittee meetings over the previous year. Public policy measure number 15. Percentage of adults who attain competitive integrative employment following participation in a paid internship program. IRC provided training to service coordinators to help them better understand the competitive integrative employment and the paid internship programs. Service coordinators reviewed employment options with clients annually during the IPP planning process. Public policy measure number 16. Average hourly or salaried wages and hours worked per week for adults who participated in a paid internship program during the fiscal year. See measures 14 and 15 as posted in the chat room. Public policy measure number 17. Percentage of adults who reported having integrated employment as a goal on their IPP. IRC employment specialists continue to train and consult with adult and transition units on integrative employment. IRC continued to develop IPPs based on person-centered planning. Service coordinators will receive continued training through the Training and Development Department as time goes by. IRC employment specialists created a blog in collaboration with the Community Engagement Unit, Staying Job Ready While at Home During COVID-19. Please follow the link to read that blog. We will also post it in the chat room. Public policy measure number 18. Average wages and hours worked for adults engaged in competitive integrated employment for whom incentive payments have been made. IRC participated in job and employment fairs to promote employment opportunities for those who participated in the paid internship program. This was conducted virtually to the best of our abilities as they were offered. Public policy measure number 19. Per capita purchase of service, also known as POS, expenditures by individuals' primary language. For primary languages chosen by 30 or more clients. IRC analyzed POS data by primary language to identify areas where we may increase purchase services to help meet the needs of underserved population. Please follow the link below to see the complete report for 2020. We will also post it in the chat room. Public policy measure number 20. Increase the number and percent of adults residing in independent living settings. Please see Measure 5 for a complete list of activities performed to accomplish this goal. Public policy measure number 21. Increase the number and percent of adults residing in supportive living settings. See measure number 5 for a complete list of activities performed to accomplish this goal. Public policy measure number 22. Increase the number and percentage of adults residing in adult family home agency homes. For a complete list of activities performed to accomplish this goal, see measure number 5. Public input. You may post your question in the chat room or raise your hand to speak. We will provide you with 3 minutes. We ask that you provide us with feedback, not testimonial.